Hi everyone. Very important things to keep in your mind if you are seeing any MSK patient. So the first one is basically you need to ask about if there is any sort of any trauma. That's a very important thing with any patient who presents to you with any joint swelling, any joint pain, any nature of any pain in the joints. You should ask about any traumas. So traumas, very important. And you need to ask about any joint stiffness. You need to ask about any pain, any severe redness, any severe swelling, any hotness, any night pain, any night sweats. So all of these are very important questions. Asking about clinical presentation and also red flags. All of these important, very important. When it comes to treatment, never ever forget about what the patient can do. So the patient can basically, with any inflamed joints, he can apply hot packs. So he can apply hot packs if they are inflamed, and that actually tends to reduce inflammation. If there is a trauma, we normally tend to ask about applying cold packs or ice packs. However, never ever advise patients to put that directly to the skin because that can cause some sort of burns. Okay, so always ice packs after traumas or heat packs if the joint is actually inflamed. So that can actually help with osteoarthritis, can actually help with rheumatoid arthritis, and even gouty arthritis as well. So all of these can be very important, so please don't forget about them. Main and the top choice for painkillers in a patient who has joint issue is NSAID. So ibuprofen, if it hasn't been tried and if the patient is not allergic to them and they have no asthma, they can also try naproxen, okay, as a higher form of ibuprofen. So they can try that. Warn them about the stomach side effects of them. You can also prescribe a stomach protection medication together with them. Never forget to give the patient information leaflets with any patient with joint related issues. Okay, and that's it when it comes to MSK disease. Common things that you need to ask about and to be aware of, please don't forget about them. And also, last but not least, don't forget about impact and how did it affect job. If it has affected job, you also need to address that, and you find ways like amended duties, phase return. All of this can be quite helpful to the patient. Thanks so much for seeing and watching me today, and see you soon.